can damage people's kidneys that filter waste from the blood, meaning some patients may require dialysis. It can also weaken the heart and cause blood clots. That can trigger heart attacks or strokes if blood clots lodge in the brain. Then there's the vomiting, inflammation of the eyes, loss of smell and taste, skin rashes, and other illnesses related to the human immune system. Amir Khan is an NHS doctor in the UK and a senior lecturer at the Leeds School of Medicine. Also in the UK, he says some of the effects of the virus could impact patients for the rest of their lives.
It's a new disease, so everything is new. We're learning new things about it all the time. It was initially thought just to be a respiratory virus, like other coronaviruses, the common cold, SARS and MERS. But we now know that the receptors it binds to, the ACE2 receptors, it can get into the intestines and the kidneys quite easily. It can travel along the nervous system as well. So we're seeing all these new long-term problems developing. So with adults, usually you get the fever and the cough. With children, it seems to have a predisposition for their intestines, and they get the gastroenteritis, diarrhea and abdominal pain. In terms of long-term consequences, there is evidence to suggest that actually it can do permanent damage to the lungs, something called pulmonary fibrosis, where the lungs don't inflate and deflate as well, even after the person has cleared the virus. And that can lead to permanent problems with breathing, shortness of breath, or minimal exertion, that kind of thing. We're also seeing people with chronic kidney disease at the end of the virus, because what it does is it affects the tiny blood vessels in the kidneys, which feed the filtration system in the kidneys. And once that filtration system gets damaged, it's irreversible. So those people can end up with chronic kidney disease, and a small number, again, end up on dialysis. And that isn't reversible. They will be on dialysis for the rest of their lives.